everyone, in this video we are talking about diaphragm. Diaphragm is the most important muscle of respiration. As you know, it is a dome shaped. First of all, we will discuss muscles of the thorax here, and then I will tell about you diaphragm. Here you must know the origin, insertion, nerve supply, actions of the diaphragm. Nerve supply is phrenic nerve, insertion is central tendon, and the most important muscle of inspiration is diaphragm. Okay, there are some muscles of the thorax that we are talking about here. That is, one is diaphragm, intercostal muscles, and there are some types of intercostal muscles, that external intercostal, internal intercostal, and the innermost intercostal. And the next muscles we must know that levator constatum, serratus posterior superior, serratus posterior inferior. Here is the intercostal nerve supply. The external intercostal, with the first rib fixed, they raise ribs during inspiration and thus increases AP and transverse diameter of the thorax. The next muscle is internal intercostal muscles, and their nerve supply is the intercostal nerve. They assist the external intercostal muscles and innermost intercostal muscles, and these all are muscles of the thorax. You must know these. You must know its insertion, nerve supply, and the actions. And the most important in this muscle is only diaphragm. Diaphragm, located below the lungs, is the major muscle of respiration. It is large dome-shaped muscle that contracts rhythmically and continually. When you inhale, your diaphragm contracts. It means tightens and moves downward, creates more space in your chest cavity. And it has three parts: sternal part, costal part, vertebral part. Here is right crus, here is left crus. Most important point is about of right crus, that it splits to enclose the esophagus. And there is also some points here in this book, that is that sternal, costal parts, vertebral part, right crus arises from the side of the bodies of the first three lumbar vertebra and the intervertebral disc, and it splits to enclose the esophagus. Left crus arises from the side of the body of the first two lumbar vertebra. That was three, and this was first two lumbar vertebra. Lateral to the crura, there is also a medial and lateral arcuate ligaments. Medial arcuate ligaments, you must know their second lumbar vertebra to the transverse process of the first lumbar vertebra, and the lateral arcuate ligament extends from the transverse process of the first lumbar vertebra to the 12th rib. And their nerve supply is phrenic nerve, C3 to C5, muscle of inspiration, muscle of abdomen straining, weight lifting muscle, and thoracoabdominal pump, and its opening in the diaphragm. It's a very important openings. As MCQs points, I have written all and make my notes about openings in the diaphragm. Openings in the diaphragm, there are three openings: aortic, esophageal opening, and the caval opening. Aortic opening, it arises from the T12 level, esophagus T10, and caval opening T8. Aortic opening, you must remember ATA. ATA is aorta, thoracic duct, and azygous vein. Yet it means aortic opening transmits aorta, thoracic duct, and azygous vein. Esophageal opening transmits EVGL. EVGL means esophagus, right and left vagus nerves, and left gastric vessels, esophageal branches of the left gastric vessels. And the caval opening, the most important, it's IVP. IVP means inferior vena cava and terminal branches of the right phrenic nerve. You must remember their points and their level points because of it's very important as the MCQs. Aortic, esophageal opening, caval opening, they transmits ATA is aorta, thoracic duct, azygous vein. EVGL, esophagus, right and left vagus nerves, esophageal branches of the left gastric vessels. And this is very important notes. I have saved them all, and if you like this notes, so please read them carefully and save them in your mind, and must remember these points. If you like my channel, then please like and subscribe, and thank you so much for watching. this video. Take care. Bye bye.